We all need a good night's rest to do our jobs, but for service members, sleep is even more critical. In a first-of-its-kind guideline, a doctor is leading the charge to help them and veterans catch more Z's.
That would be an actual sleep study.
Dr. Vincent Mysliwiec knows firsthand what lack of sleep does to the body.
I actually do have mild sleep apnea.
As a retired Army colonel, he understands the extreme stress service members face.
They are at risk for both short sleep duration as well as fragmented sleep due to their military duties and sleeping in sometimes harsh environmental conditions, trauma-related nightmares.
But this doctor is fighting to change that for service members and veterans. He's a professor of researcher at UT Health San Antonio. Mysliwiec is also the lead author of a first-of-its-kind federal guideline that'll improve clinical treatment for insomnia and obstructive sleep apnea.
It could cause them from anywhere from feeling sleepy, sluggish, not performing as well, to causing them long-term health consequences. Cardiovascular disease, it can cause increased risk of stroke or dementia.
The new recommendations are a major step forward, finally recognizing sleep disorders in the military community as a problem.
Sleep disorders were in part discounted. They were actually ascribed to other disorders, whether it was post-traumatic stress disorder, depression, pain. So the guidelines will be used throughout the nation in all the veteran administration and hospitals, as well as throughout the DoD, which would be really throughout the globe.
If you want to check out details of this guideline, look for it later under this story on KENS5.com.